Now, we have a plenary panel, which will be followed by one more ECHO talk. And so the next plenary is a word from our funders. One of my favorite things about 10 years of ECHO, 10 years I've been involved with ECHO, is hearing each person's why they participate in ECHO. And so today we have a really lucky opportunity to hear from panelists why they have participated in ECHO and funded ECHOs over the years. So I'd like to invite our panelists to come on up to the stage. Jan Schweier of Bridgespan is our moderator this morning. And you can see to either side of the stage the other names and roles of our plenary panelists. And I would just like to ask a favor of all of you. Our funders are here off the clock. They are here having fun. So I would just ask that you don't approach them, don't solicit them for funding afterwards. And besides, I've already tried, and they said no. So we'll just have our panelists come on up if they're ready to join us. Great. Thank you.
Thank you very much. It's a pleasure to try and moderate this panel, and thank you very much for our three guests to be part of the discussion. I wanted to give a quick overview of what we're going to try and accomplish in the discussion, and then give a quick chance for our panelists to just introduce themselves, and then we'll run through two main discussion points, and hopefully by the end we'll also have an opportunity for some of you to ask some questions. So the idea of the panel, as was already introduced, is to give a perspective of funders. Ideas, concepts, ambitions like ECHO need financial stakeholder support. And so we have a chance today to hear a little bit from funders of ECHO, how they think about funding an endeavor like this, what's important to them, and what are some of the things on their mind as they think about this support. My name is Jan Schweier. I'm part of an organization called Bridgespan. We advise philanthropists and we also advise nonprofits. We're a nonprofit ourselves. And before we start the discussion, one of the things that I was asked to do is to lay a little bit of context on what is happening in the broader funding landscape. But before I do that, let me just give a chance for each of you to introduce yourself.
Thank you. Is it on? Great. Jennifer Edwards. I'm here from the state of Connecticut, and I work for General Electric, specifically the GE Foundation. I lead the programming, and we've been a strategic partner with Project ECHO since 2014.
Good morning. I'm Patty Doigus. I'm Executive Director for Health Equity for Bristol-Myers Squibb. And I'll be sharing some insights from my roles both in the Bristol-Myers Squibb Foundation, which is when I began to work with ECHO, and where I am now on the company side. Thank you for having me.
Good morning. I'm Vijay Goradia. I'm an entrepreneur in the day, and we have our own family foundation that's focused on health and education, and Project ECHO is one that we have funded for a number of years, and I'll be happy to share some of the reasons behind us supporting and committed to Project ECHO.
Great, thank you so much. So already you can see we have quite a variety of different perspectives at the panel. Before we get into the questions, a little bit of context on funding. And when I think about the word funding here, the context we'll be speaking about is philanthropic funding. And the first thing to say when you think about the global philanthropic landscape is that actually most of the funding for social causes is not done by foundations, is not done by organizations. Most of the funding is done by individuals, by families. Well over 75%, for example, in the United States, of giving to social causes is done by individuals and on behalf of families, so not in a structured, organized way. That has been relatively consistent as a share. It has slightly gone down over the past years. And one of the reasons for that is actually the first trend that's maybe important to keep in mind, and that is just the significant rise of endowed assets, which is being pledged, especially by high net worth and what we would often call ultra high net worth individuals. And that's the first trend line I would want to convey here, is that there's a significant amount of global wealth, roughly $35 trillion actually is the estimate, that is held by high net worth individuals. And a significant portion of that is increasingly being committed to social causes. The biggest challenge, I think, that we see is that the vast majority of this pledge is not yet actually given, so there remain significant barriers for many funders to actually give away the money that they intend to go to social causes. The second, I think, trend is that just the degree and the size of some of the gifts, especially by high net worth individuals that have been given, is significantly larger now than, let's say, 10 or 15 years ago. And in addition, there is other structures that have also emerged, in particular collaboratives between different funders that cooperate with one another, to fund social causes around the world. The third trend that I would point to is that there's some new structures that are also emerging. Probably the most notable one to us is the emergence of so-called DAFs, or donor-advised funds. Those have risen quite sharply and play a much more significant role now in giving than, let's say, 5 or 10 years ago. And the emergence of intermediaries. So many funders choose to not create organizations with staff that look at potential directions for the money that they want to donate, but they use intermediaries, other organizations, to help them direct their giving. There is a lot of discussion, and that's the fourth one, around the term systems change. Many, I think, mean different things by that, but it is the idea to support efforts, and I think in many ways ECHO, to me at least, would represent an effort like that, that addresses a broader structural systemic issue. In the previous discussion, we saw the line that was drawn across the world, essentially, which represents a deep structural inequity in terms of access to healthcare. So how can you actually fund to resolve this deep structural inequity? That's, I think, what many people think about when they say funding of systems change-related efforts. Post-2020, certainly in the United States, but we've observed also in other parts of the world, many of the discussions around race, racial inequity, have led to a different narrative within the field of philanthropy. I think the words that come to mind are more, I think, attention of funders to funding organizations that are led by individuals of color, more funding of organizations that are more proximate, more close to the communities that they actually represent, more funding of local organizations. Some of the data is still early, I would say, in this area, but it is striking. For example, when we did some research on this in sub-Saharan Africa, and we looked at some of the large philanthropic gifts, that the vast, vast majority over the last 10, 15 years of those gifts did not actually go to local organizations, but went to organizations that had their origin in the global north rather than the continent itself. And then two last ones I would mention is the term trust-based philanthropy is, I think, a lot more in the narrative now than before. So to actually support organizations with less restrictive money, with less conditionality around it. And there's also some very notable individuals now who are making that a part of their overall giving. And then I would say lastly, we should also note that just the general view of philanthropy is not always from everyone positive. There's critique in this sector also about the potential of especially some funders maybe having an outsized influence over what happens in certain areas. And so I think that's the last one that I would share. So in general, definitely a space that I would describe as a big opportunity for endeavors like ECHO, but the potential not fully realized. So maybe with that, I'll start my first question. And I think we had agreed that we actually start with you. So I'll put you on the spot. The first question really that I wanted to ask you is, Patricia, tell us a little bit about how what your organization has supported and is supporting actually connects with ECHO, its work, its mission. What is the fit in terms of how you think about the vision for impact that the organization you represent stands for and what ECHO actually does.
Thank you. So in my role as Health Equity Executive Director for BMS, I have sort of two different jobs. So one of them is to build capability and change mindset within our organization so that innovative medicines are developed with equity in mind and with inclusiveness in mind. And a big part of that is the other piece of my job, which is forming external partnerships to drive it. We certainly cannot do it alone. And so we need support and help and collaboration from organizations like all of you and certainly Project ECHO to get there. When I started to learn about ECHO, as I mentioned, I was in the Bristol Myers Squibb Foundation. And we, as a specialty care company, so we work on cancer, immunological diseases, very difficult cardiovascular diseases, and hematology, so all specialty care. So I was looking around for different models of ways to upskill and bring more specialty care capacity to underserved communities and to rural communities. And you do the Googling, there comes ECHO, came up right away. So then I had a chance to meet Sanjeev, and since I was in the foundation, and this will be important for lessons later, we could really together explore where there were commonalities and need. And cancer was an area that ECHO was just getting started in, and certainly we're very concerned about cancer and involved in cancer at BMS. And so that gave me an opportunity to work with Sanjeev and his team to co-create what's Cancer ECHO today. And initially it was focused on the US and Africa, and we've seen many of ECHO partners take it elsewhere. So there was an alignment there, both from a health equity mission and also a therapeutic area that we were very committed to as well. And then something came up opportunistically with COVID. We knew right away that ECHO would be playing a major role in COVID, so we supported Sanjeev and his team on that. And then in those years, in 2021, I stepped over to the company side and had a different opportunity with corporate giving grants, corporate philanthropy, which have a lot more regulation and rules and things like that around them. But we could at least put out areas of interest. And so I had shared with Sanjeev what those areas of interest were. One of them was in the area of beta thalassemia in India. And in that case, the ECHO India team put together with Sanjeev this capacity building program. It's a national program to train and to train healthcare providers, but also allied health professionals who are involved in the full continuum of care, from prevention to treatment to care and supportive services as well. So it's a national training program. So really updating the curriculum for that, and then also working very much in high need areas within India with this high beta thalassemia as well. And then also I took a look at what other corporate giving grants have been made to ECHO projects. And because of the visibility of Cancer ECHO, because of ECHO's visibility through COVID, medical teams within our organization were very, very much interested to see how they could get more involved. So there are, across our therapeutic areas, hubs, some of you in this room, that have Bristol Myers Squibb corporate giving grants as well. So, but it all, for me, starts with, the first day that I met Sanjeev, and it was clear that we were both very committed to equity and inclusion, and it didn't seem particularly fair to us that all these incredible medical innovations were coming forward and that communities were being left behind. So sort of with that together that we've been working over the last few years.
Great, thank you so much. Jennifer, if I turn to you, does that resonate? Was the starting point for you and GE a different one, similar one? Tell us a little bit about how the connection was made and what's the core of the connection as you look at it today.
Sure. So first, I want to thank Sanjeev and the team for having me here to speak with you. I have to say, I continue to be inspired by all of you, listening to yesterday's sessions. The work that you are all doing, the hard work that you're doing across the globe is awe-inspiring. You are making a difference, you're having impact, you're bringing joy to work, you're saving lives, you are making this world better, so thank you for that. So, Jan, you gave a great overview of some of the trends in philanthropy, And I'd like to share our perspective from a corporate private foundation, the GE Foundation. Not sure that everything's going to resonate. I know we have a very, very global audience, but if each of you take one or two nuggets from this discussion, I think that's a success. So let me tell you what our why was. But in order to do that, let me just give a little bit of background. So General Electric is a 132-year-old company. The GE Foundation, which is the philanthropic arm, is over 100 years old. And we have deep roots in education. But in the 2000s, we launched our health portfolio. We started in the US. And the focus was, how do we bring more access to people who are underrepresented, underserved, vulnerable populations? And we decided that we would focus on community health centers. And many of you know they are in urban communities, they are in very rural communities across the US. And as we began to stand up the initiative, we realized that where we could really support would be capacity building in those organizations and focusing on healthcare providers. And as we learned more about Project ECHO, we realized that the missions were completely aligned, okay? So that was incredibly important for us. That was the why. Their mission, right? Dr. Aurora's a mission to bring medical knowledge to the right place at the right time was a very hard thing to do. And it was focused on capacity building, so we were aligned. We also love the bold vision. So General Electric is a company, we like big problems. And Thomas Edison is our founder, and he was wildly known for saying, I look for what the world needs, and then I try to invent it. And does that sound familiar? So Project ECHO, the why for us that opened the door for the first pilot funding for Project ECHO was that the alignment was there with our health portfolio under our foundation, and also aligned kind of with the values of the company.
Great, very interesting. Vijay, I wanted to turn to you. My hypothesis is that some of this might resonate, but then you also have a very personal view. You represent yourself, your family also in the foundation and in the giving. How does ECHO fit in? What was the origin, and how do you think about the context of why it might be still in your purview today?
Yeah, thank you for asking, Jen. Unlike these two amazing ladies here with many years of experience and expertise and support of large organizations, ours is a relatively small family foundation and funded by our family. We focus on, broadly speaking, health and education, as I said earlier, but within that space, we try to seek out organizations that are focused on making systemic changes that are hugely transformational, not just applying band-aids to an existing problem. We fund organizations that we believe are rapidly scalable, that are very measurable. We fund organizations on a multi-year basis with a long term in mind. And before I even heard about the term trust base, for years we've been actually applying that by recognizing that the leadership that run these NGOs have the necessary expertise and know much more about the problem and how to solve it than we will ever know. Um, the other thing we look for is that the NGO does not have a very high overhead cost. You know, there are so many wonderful organizations, but they spend 50, 60, 70% of the money they raise on admin costs, and we tend not to focus on those NGOs. And last but not the least, the quality of leadership. It is so important that the leadership not only has the vision, but is ability to translate that vision into meaningful action and inspire many, many people to join in that mission. And so, listing out many of these prerequisites for us to want to fund an organization, I mean, Project ECHO checked out all the boxes and then some. And to me, Dr. Arora and his team and all of you in the audience, you are the real rock stars. For us, it's a simple issue of doing our due diligence before selecting the organization and then just keep writing checks. You guys do all the heavy lifting, and I think you all deserve a round of applause.
I wanted to come back with one follow-up question for each of you, and if I may just stick with you since you were last, Vijay. One of the things that has been striking when you observe sort of the philanthropic space a bit from the outside is this increasing dedication of many organizations and individuals to think about their wealth in a very different way and to essentially commit it to social causes, in a significant way. Yet the barrier between the intent and the actual giving remains relatively high. You seem to have found a way, though, as you say, to check all the boxes. What do you observe around you in the networks and in the maybe parts where you discuss maybe similar intents of others that want to give to organizations, and what's holding them back, and what's your observation there, and what can those that seek funding do to actually help funders to commit?
Yeah, good question. So over the years, what I've observed is, there are different types of givers, and I will not discuss corporate donors. These ladies have a lot more expertise and knowledge on that, but high net worth individuals, many of them either are interested in funding something that they want control over, or they want their name on the building. There are others who have the desire to only provide short-term funding, and others try to give money where they have a feel-good, feeling. They like visiting an orphanage and seeing in a developing country and looking at those kids and writing a check and feeling good about it. There are very few high net worth donors that I have interacted with that are truly thinking about making systemic, long-term impact. And it's the whole idea seems a little nebulous to them, and it's a question of making them see the value, and that takes time. But I think the younger generation is probably a lot more open to that, and I see the younger generation walking away from seeking control over an NGO or having a say, and are looking for equity and systemic changes.
Yeah. Follow-up question maybe to both of you, starting with you, Patricia. You both spoke about the mission alignment, the kind of fit with the corporate vision that you represent. How do you keep the interest level, though, amongst shifting priorities in a corporation? How do you keep the interest level for an organization's idea for impact high? What are some of the things that you have observed that are really important when you think about corporate structures as those that want to give to social causes?
Well, it definitely helps to have, if your company wants to address health equity, have a health equity officer. So, and we see this in institution after institution, companies, health systems, health plans, the government. There's now this new kind of role called the health equity leader of some kind that often has accountability very high in the organization because of the environment, which is said, really deliver on that commitment. It cannot be window dressing. It cannot be a sprinkling of trying. Really, I think the pressure comes from the outside and from the inside too to make those kinds of investments that really make significant change. And since we are an evidence-based, data-driven company, Dr. Aurora gave us the evidence base. He more than proved the proof of principle behind it. So what we want to invest in, given how much the health equity community, before this recent sort of new investment or increased level, has done to try and find ways to improve access to care for underserved, to improve health outcomes. A lot of the answers are out there and have proof of principle behind them and data behind them. So that's the other thing that we look to do, is invest in evidence-based practices.
Jennifer, what are your additional thoughts from your vantage point?
So I would like to pivot a little bit in that question and share with you some more ideas about what funders may look for. And again, this is from the Private Corporate Foundation, but I'd like to kind of reiterate what you've already heard. Impact, right? Impact, the ability to measure that impact. That kind of goes without saying. We also look at overhead, so consider that as you're putting a proposal forward. We talk to alignment, all right? But funders like scalability. They like the ability to replicate. So if I think of General Electric, 50% of our population is outside the US. We need our philanthropy to really match that. So the fact that Project ECHO could scale outside the US was very interesting to us, and why we came back with further funding. The ability to replicate. So you all have replicated within other disease states, but some of you have also replicated in different sectors. Education, quality improvement. Okay, funders like that. Partnership. You spoke to leadership. Partnership. GE, we don't write the check and walk away. We're not that kind of funder. We want to be a thought partner. We want to walk alongside you. And I think Elizabeth would agree. We've done many miles. We like to bring our business practices, our processes to you as an organization to help support you to grow and to be even better. Passion. Don't be afraid to show your enthusiasm, to show your joy of work. It was the passion that I saw firsthand from Sanjeev and his team that really hooked me. And I think lastly, storytelling. I feel like that's the new buzzword, and it sounds like it's an easy thing to do. Some are really good at it, but think about how you can tell that story to the potential funders.
It's actually a great segue to the second sort of line of questions that we wanted to bring to the discussion. And one of the things that we observe also in our work with many nonprofits is that they share with us that they often feel is that their mission, their vision for impact somehow gets lost in the translation when they speak to potential financial stakeholders and funders. Somehow, what I want to achieve doesn't translate so that it connects well with the funder. In the engagement, there's something that's not quite working. So I guess my next question, and I'll stick with you, is when you think about interactions with organizations that seek funding from you or from your organizations, what are some of the things that you would say, I wish there was a lot more of that? You mentioned already a few, I think, key ingredients, few practices that impress you, that make you want to engage more, that you think are interesting, innovative. What's in that more of bucket that you would suggest those that are in the audience that might be engaged in fundraising to do a lot more of? And what are some of the things that you actually struggle with that make the conversation more difficult, maybe more difficult to actually execute on? What are some of your thoughts on that?
So first, do your homework, right? And do your research. So identify who are the funders in your area, your region, nationally, that you're interested in approaching, okay? GE Foundation's a little different. We don't accept unsolicited grants, so that's good to know, right? There are funders that have grant cycles, right? Or they have whole portfolios that you can apply. Robert Wood Johnson Foundation is one of them, right? They have an open call for grants that fit within a certain focus, right? So know that about the potential funders. But also those that you do the research and you feel like you have that alignment, know what the goals are. What is that foundation within that portfolio trying to achieve? And then clearly demonstrate to them, as you meet with them, how your program helps them achieve their goals. Just a couple thoughts.
Hand it to you.
Yeah,
What is in the more of and what might be in the less of bucket for you, Patricia?
Yeah. So I would also say, and this goes to some of your last questions, resources are tight. My own company is going through a big change now. We're getting ready to be ready for the next chapter. So we really encourage collaboration and partnerships. So show up with other partners. And when we talk about one of the trends you spoke of in terms of more local investing, community-led investing, that's really important to us, that major organizations get together with organizations that are well-known, well-trusted by their community as well, and that equity principles of shared power, et cetera, are also in play. So that's really important for us as well. Also, from a funder side, I always love it when people come and say, and we're looking to do this with a number of funders together. We're not just asking you to support the whole thing. And I've told Sanjeev, for some of the things he's looking to do in the future, can we help him to bring a couple of funders together in the same room? Because believe me, peer pressure does work with the funders as well. So that's another thing to keep in mind. As far as engagement, Jennifer has said it, look at our website. We have our areas of interest there. You can see who we fund to get kind of an idea of it. Know that evaluation is important in that when you're doing that. But we also like to know what's going on outside of what is specifically funded by the grant. So are there policy initiatives to take what you learn and what you accomplish through your grants, to take it to policymakers to say, see, this works, this has helped our community, this has achieved our nation's public health goals. Can we now work with you to develop some enabling mechanism to get more funding or other kinds of support like that? So that policy and advocacy work that's going on around outside is really important. And as an advocate for applicants, I do like to know what the longer-term vision is. So on the company side, the grants are a little bit shorter term, much shorter term, more like 1 to 2 years, as opposed to the foundation where we could do 5, 10 very long-term initiatives. But I like to know what this project is sitting in within a bigger vision of where you're headed. Then that helps me to give the voiceover on advocating that and potentially sort of prime the interest for future funding if it continues to match with different priorities and needs.
Vidya, I'll close this one with you. What are some of your ideas if you were sitting on the other side of those that want to speak to you as a family foundation? What are some of the things that you would suggest?
Yeah, so I've worn two hats over the years. One is, of course, giving money through our foundation, but I also have worn the other hat when I founded an NGO in the US called Pratham, which now impacts as many as 75 million children a year. Over the years. And in trying to grow that NGO, I had to carry the begging bowl and go to people and try to get them interested in contributing for the organization to scale. And so if I wear that hat of the challenges and the efforts I put in to go raise money from other high net worth individuals, I learned a few lessons very quickly. One is that be very clear in terms of what problem you're trying to solve as an organization. And don't be long-winded. People don't have a lot of time or an attention span, especially high net worth individuals. They want to just get to the bottom line. So, use bullet points, be very clear, and if possible, try to find an anchor donor who is committed, and then put him in the forefront and create, with the help of that anchor donor, create a circle of giving, sort of, that anchor donor can then rally and corral. The other thing I learned is persistence pays. Don't expect to write an email or a letter and expect that potential funder to write a check. It's not, more than likely it's not going to happen. So don't be pesky, don't be a pain in the butt, but certainly be persistent. And the other thing is share the results, share the performance on a timely basis. The results would speak for themselves. And last but not the least, there's nothing like getting a potential funder to go visit the program, and in this case, maybe persuade them to participate in these hub Zoom calls or in-person meetings, where they see in action what these experts are trying to achieve at the spoke level. There's nothing like getting them to see you in action. And the rest will follow.
Yeah, thank you very much. This actually very much resonates. Maybe one data point to add to what Vijay just said. We actually, as an organization, looked at the pattern of significant large strategic gifts to organizations. And the data clearly confirms that large amounts of philanthropic contributions typically are preceded by 2, 3, 4 smaller ones over a period of time. So it takes indeed that cycle of trust building before someone commits. And that's irrespective of whether it's a high net worth individual, it's a family foundation, it's an institutional foundation. That, I think, pattern very much resonates.
And if I can just say something, sometimes when you are swinging for the fences, when you really do have a very big project that you want to pursue that's going to take a lot of funding, it is okay to ask for a planning grant. And that's exactly what the Bristol Myers Squibb Foundation did with Sanjeev, so that he could really put his team together. We're trying something new, we're trying something big. Let's really make sure that beyond the very good application, that we're ready at another level to then begin project work when the full funding comes through. So that is something that is definitely okay and important. And it really shows a kind of honesty, that trust base, that we love this idea, we love that you're sharing the dream, but we do need a little bit more just to get fully ready to start to deliver on what the grant is supposed to do.
And just to reiterate that point, that's how our journey began. It wasn't a planning grant, but it was a pilot grant, specifically here in New Mexico, to support expanding access to mental health services in community health centers in rural New Mexico. And once we saw and learned more, it gave us an opportunity to get closer to Project ECHO, to learn more about not only the model, but the team and the leadership. And once we got that trust and that comfort, that's when the larger grant came.
I had one last question before we hopefully can open up for some questions. I imagine many of you would like to also ask direct questions. One of the things that you spoke about, Vijay, also was, and I mentioned it in the beginning, is there's a lot more discussion now about funding broader systemic efforts, more deeply entrenched issues versus individual pieces. Yet at the same time, I think many nonprofits that we work with also tell us that the very idea of funding into a space where more collaboration between actors is needed to resolve it. The timelines are longer. The specificity of what you are doing might be less clearly visible to a funder. The amounts might appear a little bit more risky initially. As much as there's a huge discussion about systemic structural funding, there's also a little bit of a hesitancy to get into that space. What could be done to make this word, this term, systems change, which I think very much represents what ECHO is about, deep inequity in access to quality healthcare? What could be done to make it less of a cloudy, maybe confusing term that might be a hindrance actually to funding, but might actually really support it? I'm just wondering if what you have observed in your own organizations and your own narrative of how you speak about it.
I'll defer to my colleagues.
No, it is definitely difficult. And I think part of it is just continuing to be part of the education on why we need systems change, and what sometimes explaining like the structural forces that are in play that are responsible for the conditions on the ground is a good way to begin to do that, right? And so so let's say, for us, we're really interested in making sure that there is, again, the specialty care capacity in communities across the country and around the world, so that medical innovation isn't something that folks wait for and eventually somehow it happens. But even sort of reframing the issue, that part of what we've tried to do is say, there's this incredible moment in science, and then there's this credible mobilization around equity. And so how do we bring those together? So what we're actually trying to achieve in terms of science improving human life actually gets there to the bigger need and generates more health and wellness. And then pointing to some of the structures that have been kept in place and acknowledging our own roles too in sometimes perpetuating some of that, and how can we sort of unstick those. So for example, diversity in clinical trials might be an issue which needs a lot of community mobilization, support, education around it, so we can realize inclusive research. So that would be a big systemic change, for example. So I think that's, the examples that we do have, just showing them, whether they're in the healthcare space or climate change, wherever it is, just showing, sort of revealing the assumptions of how things work now and how they leave folks out. But if they could be moved to a different place with a kind of vision, then you can start to stack. And then you really do need North Stars. And having worked in global HIV/AIDS, we saw the North Stars that was set by the WHO and UNAIDS, and everyone lined up behind them and marched together. So I think it's a two-part. So that mind and that awareness change, because those forces can seem like they're out in the ether, and how can I even impact them? But if you can really point to them, you can begin to make a difference, and then get some collective agreement on what we want to try to achieve over time.
Yeah. Any additional thoughts?
Just really well said. And I mean, it's a big problem, right? And it's really hard work, and there's a lot of work still to be done. But again, from our perspective, GE Foundation, that's where philanthropy can play, because we're not going to get it right all the time, right? It's where we can test, we can pilot, we can demonstrate, right? If we get it wrong, if we fail, we pivot. And that's one of the beauties of philanthropy.
Great. I want to make sure there's enough time for anyone that might have questions, for panelists, for any of us here. I don't know exactly how this is going to work, and this light is blinding me, so I am actually wondering. I think there's microphones, right, in the audience. Yep, I see someone there, see someone over there. Should we maybe start? The light is pointing. We're starting in the middle. That sets the pace. Maybe if we take 2 questions so that we don't forget anyone, and then we move to the next section. Would that be okay? And I see someone standing right there. Great. If you could just quickly say and introduce yourself by name and who you represent, and then what your question is. Thank you so much.
Yes, thank you very much. Dr. Alan Hakim, I represent the Ehlers-Danlos Society, and I'm struggling again today because of the feedback. There's a delay, so I apologize if I sound a bit strange. We're an international NGO, and we work in the rare disease space. And I thank you so much for all of your insights, because I can see how they completely apply to us. But 2 key areas for us is our closeness or proximity to our community is extremely challenging, because there are very few patients all over the world. And also, our scalability is relatively small, inevitably, because we're in the rare disease space. And I just wonder if there are any nuances in the conversation with the rare disease community that are different from these sort of larger scale, systemic type models that have been alluded to today so far.
Could you just, repeat? It was a little bit hard to hear. There's a bit of a flimmer.
Yeah,
and just
it's about whether there are any other insights that are nuances specifically in the rare disease space with the smaller populations, where perhaps these large systemic changes that we're looking for are well, they're never going to happen. It's a different space.
Because the population that's affected is just smaller.
The population is smaller. I mean, absolutely, the impacts are just as profound, but I feel it's a different conversation, and I wonder if you have any insights.
Great. We take one other question, and maybe in the meantime, one of you can think about whether you feel equipped to answer. Is there a second question, maybe? Right there.
Thank you very much. Martin Diffner from Japaigo. Thank you, presenters. I thought you could say something more about climate health and the interest of private and high net worth in donors and possibly corporates, because this is taking a lot of interest in the world, and also NGOs and persons like the ones who are here would be interested and see how to pivot around using it and the eco networks that we support.
Right. So I think the first question was the rare disease space, populations that are affected are smaller. How can you actually credibly make the argument that this is a large systemic effort that you're trying to accomplish, when actually the unit of change is by force smaller? And any kind of observations, I guess that was really the questions on that.
Yeah, I mean, rare diseases is tough because of the competition and the force and organization and share of voice that larger organizations, but I think it is on us as funders to always be aware of those smaller organizations. Again, this, I think, can go to collaboration, though. There are probably common things that are trying to be accomplished in terms of health system strengthening between those focused on a major issue like diabetes or HIV, as opposed to those who are working on a smaller disease state. So whether it's the NCD Alliance or other ways, I would just look for commonalities among what you might have with other groups, and sort of maybe together you can build a certain kind of capacity that's useful across both your patients' needs as well as in other disease areas. But it is very, very difficult, for sure.
And then I think the second question is just, what are you observing around the discussion about climate and health and its intersections, or climate health? Curious where that is in your own thinking, where's the discourse in your organization on that? And how do you, for example, also think about it from your perspective? Maybe Vijay, if you have a view.
Yeah, you know, I travel around the world, and I've been doing it for 50 years now. And frankly, the impact of climate change on health outcomes is very, very visible. And it's hard not to, as a donor, as a funder, not to incorporate the impact of climate change to health outcomes and not weave that into your funding initiatives. Specifically, we don't directly fund climate initiatives, but to the extent they impact the well-being of an individual or a group of people, we will certainly look at funding those. And it can take a number of different forms. I won't go into the detail, we don't have enough time, but it's definitely something that we have to be cognizant of and weave it into our decision making.
Yeah, the question brought me to another trend, which is ESG. So on the company side, just the ESG frameworks, the reporting, the grading, all of this, that is internally connecting us much more across the different, the different domains of ESG, including environment and climate change and how that's impacting health as well. So I think it's really important to know that that's like a growing area of interest, certainly within companies, certainly within our company, because again, with specialty care, if something is disrupted by a climate event, those patients are, very seriously needing their medical care and support. And if that gets upset, like we saw Maria upset so much in Puerto Rico for cancer patients and other kinds of patients, it's just really, really important. So I guess that's just another tip, is if you can look at companies' ESG frameworks and what their goals are, that can also help you to tie into what they're trying to achieve. And sometimes applicants help us to make the stronger connection between health and climate, for example, or society and climate.
One quick comment, and it's the beauty of unrestricted funding, okay? So as this topic comes up, our funding is all about capacity building, but we have unrestricted funding for Sanjeev and the team to support replication and scaling. So as you as teams start to focus on climate impact healthcare and bring that to learn how you can leverage Project ECHO to do work in that space, our funding supports that.
I do see a light blinking, which is red. That's not a good sign usually. It means you need to hurry up and get off the stage. Are we still okay for one more question? Because I see someone standing there. I see no dispute, so we're just going to do it. That's okay. So last question. Thank you very much.
I would like us to consider, I am very passionate about rare diseases. For example, every pediatric cancer diagnosis is a rare disease because of the number of population that it affects. So rather than looking at a disease, I would like us to look at the population health of the serious illness population, and especially palliative care. So rather than just picking a disease, say anyone who can be described as having a serious disease, which is any condition with increased risk of mortality that adversely affects their quality of life or that of their family caregivers. Those are the people that I would like to see us target, and I'm especially passionate about this because my child died, and I learned after her death, she told a hospital administrator, she was only 14, that she always wished she had cancer because people would know how sick she was and she'd have a community of support and people who took a team-based approach to her conditions. So I would really like us to see if you would be interested in the serious health population.
Well, I think we work on serious diseases. You can see the full list of them at BMS. But I think what you're speaking to is how do you cross-therapeutically propose a grant? And I know that for us, even if it isn't 100% in lung cancer, which is a major priority, but in a range of cancers or a group of diseases that you see this need for, I think as long as there's some piece of what the company or the funder is focused on, then there's an opportunity for that. But I definitely think cross-therapeutic initiatives are very important too.
I'm going to take the cue now and just thank all of you for spending the time with us. Thank all of you for listening. We hope that the discussion had some interest and that you took some learnings away. Thank you very much.